Hello, my name is Brandy Jones. I'm the Perinatal Hepatitis B and Adolescent Vaccine Coordinator within the immunization program at New Mexico Department of Health. I'm going to be covering the three different programs that I cover. So perinatal hepatitis B prevention, adolescent vaccination, and maternal child vaccination. Starting out with perinatal hepatitis prevention, um, we still see a significant amount of hepatitis B worldwide, with 1.2 million new infections each year and 254 million people living with chronic hepatitis B as of 2022. We also see 1.1 million deaths resulting from hepatitis B virus infection. The hepatitis B prevalence increased in the United States several years ago, and they saw that increasing. So there is a goal to get that reduced. Our goal for this year, 2025, is to reduce it to 18,000 cases in the United States, and with a target of in 2030 to reduce cases to 2,200. I do like to remind providers and clinics that hepatitis B is a mandated reportable disease, both federally and by state. And New Mexico requires providers at healthcare providers and laboratories to report positive cases within 24 hours. We do see significant number of lab reports coming in. However, I think frequently providers depend on the labs to do the reporting, and they are required to report as well. So they can access that notifiable condition report form from the New Mexico Department of Health website. And that goes to the epidemiology department. Hepatitis B virus is transmitted through infected blood and body fluids, so sexual contact with an infected person, drug injection equipment, and personal hygiene items such as razors or toothbrushes. But the most common mode of transmission worldwide is from birth to an infected mother. We also see that the potential for chronic infection increases the younger the exposed person is. So 5% of adults with a new acute infection of hepatitis B and virus will develop chronic hepatitis B. Children with a new acute hepatitis B infection, ages 1 through 5, have a 25 to 50% chance of acquiring chronic hepatitis B. However, without post-exposure prophylaxis, an infant that is exposed from their gestational parents has up to a 90% chance of developing chronic hepatitis B. So that's why it's so important that we are putting in prevention strategies to try and prevent that infection. Hepatitis B screening recommendations for pregnant people is universal screening at the first prenatal visit every pregnancy. So even if they just had a baby last year, they should be screened again. The interpretation of that hepatitis B surface antigen test should be confirmed with a confirmatory positive testing. And usually the lab reflexes that automatically, but you should make sure that that was done to make sure that we don't have a false positive in that surface antigen. Additionally, people that test positive for the hepatitis B surface antigen should be followed up with hepatitis B DNA testing later in the pregnancy. That helps to determine the viral load to see if they are in need of antiviral treatment before delivery. Testing should also be completed upon when they're admitted to the hospital for delivery if they have clinical hepatitis, if they are high risk, have high risk activities during pregnancy, so injection drug use, more than one sex partner in the last 6 months, specifically a hepatitis B surface antigen positive sex partner, or they're being treated and evaluated for other STIs. Also, if they were not tested prenatally, they should be tested upon admission to the hospital for delivery. We see this frequently with people in our state that have not been able to access or receive prenatal care throughout their pregnancy. After you have a patient that is positive for hepatitis B virus, they should be counseled on transmission, disease progression, and treatment options. They need to be referred to my program, so the Perinatal Hepatitis B Prevention Program, and that could be done either directly to me or when you submit the notifiable condition form to the Epidemiology Department of Health, they contact me to collaborate on the pregnancy cases. Additionally, they may need referrals to gastroenterology or hepatology to follow up on those elevated hepatitis B virus DNA results and antiviral treatment. Our major prevention strategy for hepatitis B is vaccination. It's recommended across all age groups, and pregnant people identified at risk should receive the vaccination during pregnancy if needed. Our main strategy with vertical transmission, so vertical transmission is that transmission from the gestational parent to the infant. So they should receive post-exposure prophylaxis, and that includes administration of the hepatitis B vaccine, as well as the HBIG or the hepatitis B immunoglobulin. That should be given to newborns within the first 12 hours of life. After that, they need to complete a 3-dose hepatitis B vaccine series or 4 doses if the birth weight was less than 2,000 grams. Additionally, they should be receiving post-vaccination serology testing after 9 months of age or 1 to 2 months after the last hepatitis B vaccine dose if those doses are off schedule. I do like to note that it is safe to breast or chest feed during if somebody is positive for hepatitis B surface antigen. The transmission risk is negligible, especially if they received the post-exposure prophylaxis. The only time that would be of concern is if there's nipple damage or bleeding, and at that time, breast or chest feeding should be stopped, and pumping and dumping should be utilized to make sure that transmission risk is decreased. Noting on the follow-up for infants is the post-vaccination serology testing. Like I said, at the infant needs to be at minimum 9 months of age. It cannot be done before that. And then they need to have hepatitis B surface antigen and anti-HB levels drawn to determine, number one, if they have contracted hepatitis B, so if that surface antigen is positive, and number two, to determine if the vaccination series was effective and that they've developed immunity. There are some cases where an infant did not develop immunity to that 3 or 4 dose series of the hepatitis B vaccine, and so they may need an additional dose or to repeat the series to develop immunity. So your role, our role as public health in preventing perinatal Hep B is collaboration between your clinics and healthcare facilities and our perinatal hepatitis B program, as well as other programs across the state when we have transfer across the country when we have transfer cases. We want to make sure that we're tracking and following up with hepatitis B positive pregnant people and exposed infants to ensure that those strategies are being utilized. Moving on to adolescent vaccine initiatives, our main focus right now is HPV, but we do obviously want to make sure that all kids are up to date on their recommended vaccinations. Our target with HPV is to make sure that people understand that the HPV vaccine is cancer prevention. As a quick review, human papillomavirus or HPV is a common viral infection that can cause cancer later in life. It's approximately 13 million new infections each year in the United States, including teenagers. There are more than 42 million people in the United States that have a type of HPV infection that is known to cause disease. And most surprisingly, 80% of people will get HPV at some point in their lives. Many HPV infections resolve spontaneously on their own within 2 years, but some can last longer and cause cancerous cell formation. So if the body is not able to rid, or if the immune system is not able to rid the body of that infection, that prolonged presence of the HPV virus can cause those cells to become malformed and cancerous. HPV causes approximately 36,000 cases of cancer in women and men every year in the United States. Another misconception is that this affects only females, but it does not. There are 6 different types of cancer that can be caused by HPV, and you'll see those listed on the screen. So for women, that is cervical, vaginal, vulvar. Both male and females can have oral and anal cancer, and males can get penile cancer as well from HPV. Again, our main prevention strategy is vaccination. So HPV vaccination right now in the United States, we use Gardasil 9. That 9-valent means there's 9 different strains that are known to cause disease that are covered by that vaccination. It is most effective when the vaccine series is administered before the person is exposed to the virus. 98% of vaccine recipients will develop an antibody response to the HPV types in the vaccine. So those 9-valent types that are in there. As of right now, the CDC is recommending 11 to 12-year-olds get 2 doses of HPV 6 to 12 months apart. Vaccination can begin as early as 9 years of age. Only 2 doses are needed if the first dose is given before the 15th birthday. Teens and young adults who start the HPV vaccination series after their 15th birthday will require 3 doses. And there are considerations for age groups 27 to 45, and that is a shared provider decision after conversations and risk factors being discussed. The HPV vaccine is generally very well tolerated. There are minimal reactions that include pain and redness and swelling at the site of injection, which is common with most vaccines or injections, a small chance of fever, and anaphylaxis is very rare. There are no other serious adverse reactions associated with any HPV vaccine. It's best at 11 to 12 years old. Preteens have a higher immune response to the HPV vaccines than older teens. So while we know there's very little risk of exposure to HPV before the age of 13, it increases thereafter. And like I said previously, we really want to make sure that vaccination has been given well in advance before exposure, and that so that the body has time to develop immunity. We do have a lot of challenges that come up with getting our HPV vaccination out there. There's a lot of misinformation about the vaccine, some cultural beliefs that feel like giving the vaccine opens the child up to increase the risk of sexual activity at a young age. And then, of course, because of socioeconomic and different healthcare disparities, there's accessibility issues to the vaccine. So some of our strategies for increasing the rates are making sure that we're providing accurate data from trusted sources, that we're increasing health and vaccine literacy, and increasing access to vaccine through programs like our VFC program, and collaborating with healthcare providers and community leaders like yourselves. And as a quick overview, I'd just like to touch again that the HPV virus is very common, and 80% of people will get an HPV infection at some point in their life. Preventing cancer is better than treating it. And again, HPV can cause 6 different types of cancer. And only cervical cancer of those 6 is routinely screened for. So it's important that we have these protections in place. The HPV provides safe, effective, and long-lasting protection with over 100 million doses distributed in the United States, and data continues to show that the HPV vaccine is safe and effective. Additionally, the children can get the HPV vaccine at the same time as their other routine childhood vaccinations. We do have some sources available if needed for your clinics. You can reach out to our program and we can get those for you. So this is an example of one of those resources for just an adolescent vaccine schedule. And then we also have some more disease-specific or other vaccination pamphlets that can be provided as well. And closing out with maternal childhood vaccinations. Vaccinations recommended for pregnant people include Tdap, influenza, COVID-19, and RSV. Additionally, pregnant people, depending on risk factors and risk of exposure, may need the hepatitis B vaccine, meningococcal, or pneumococcal vaccines during their pregnancy. The CDC has excellent resources for immunization schedules and pregnancy and vaccination toolkits for prenatal care providers. And those are all available through the CDC website linked here in the presentation. Touching quickly on RSV, is a very common respiratory virus that causes mild cold-like symptoms. However, severe RSV and the need for hospitalization is more likely to develop in very young infants and older adults. So CDC recommends RSV immunizations to protect some infants, children, pregnant people, and older adults. Here you can see those recommendations outlined from the CDC site. And so adults 60 and over should be able to get the RSV vaccination at any time, but it's best to get it in late summer or early fall. As far as maternal child vaccination, it gets a little complicated. Newborns who the pregnant gestational parent did not receive the RSV vaccine during the pregnancy should get nirsevimab or the RSV antibody shortly after delivery. After it can be given right after birth, but that's seasonally October through March. And then pregnant people can get only a Brisvo. They cannot get a Rexv during the pregnancy, and that is administered if they are pregnant 32 to 36 weeks pregnant between September and January. The vaccination does need to occur at least 2 weeks prior to delivery in order to transfer that protection over to the baby. The CDC also has a very helpful, I think this graph is very helpful in determining the time range and who should be getting the Brisvo during their pregnancy. It just gives a good visual for that. We want to make sure that we're providing trusted resources with sound scientific backing. So of course we have the CDC site listed here. The Pink Book is a good resource for vaccination and infectious disease. And then of course you can go to nmhealth.org for our New Mexico Department of Health website. Additionally, we have the nurse helpline that's available for answering questions. If your facility does not have a certain vaccination available, you can reach out to them and they can direct you to a clinic or facility that has that vaccination available. And here's my contact information if you have any questions or need any guidance, especially on perinatal hepatitis B prevention. I am available and please feel free to reach out.